Every day, more and more pet parents, they're turning to natural remedies to help their dogs and cats. There's an array of different ones. Could be that spice that came out of your kitchen cabinet. Might even be something as simple as honey to treat your dog or cat's wound. Many of these remedies, they're shown to be effective, yet time and time again, Big Pharma and all those conventional guys, they just completely dismiss them. Today, I want to talk to you about why that is. Why these natural remedies often labeled as ineffective or unproven. And what are the real reasons why Big Pharma, they're happy just to keep them in the shadows.
Are you looking to learn more about natural pet health and wellness? You've come to the right place. Click the link to subscribe to Veterinary Secrets.
Let's start with herbs. For literally hundreds, if not thousands of years, these natural common products like turmeric, nettle, even the cannabinoids from the cannabis plant, they've been medicinally used for hundreds, if not thousands of years for an array of different health conditions. Take this Chinese medicinal herb, Yunnan Baiyao. It's now being widely used, even conventionally, specifically for bleeding, especially with our dogs that have hemangiosarcoma. It's a tumor of the lining of the red blood cells, and almost one of the big huge side effects is this spontaneous hemorrhage. It's one of the only treatments, natural, conventional, that works really well for that. And one of the simple things that is in this, one of the primary ingredients, it's actually potato starch. That's right, potato starch. It can have such a big beneficial effect. And this is literally thousands and thousands of years old. Get all those smart guys at Big Pharma, they're like, there's no science to that. You can't use it. It doesn't work. Get our drug. It's going to save your dog. There are literally thousands of case reports, and many cases, even gasp scientific studies showing things like the natural product, aka honey, is so much better for wound healing than even many of our so-called conventional effective antibiotics. Or Yunnan Baiyao, right? One of the few natural products that actually works against hemangiosarcoma. My entire channel, it's all about home remedies for dogs and cats. There are literally thousands and thousands and thousands of subscribers, people like yourself, who've commented on the videos, reported how so many of these home remedies have specifically helped. Be it some alternate home remedy for this chronic ear infection, right? Or an animal that has chronic diarrhea responding to slippery elm. So many different people have reported like these have really, really been helpful. So yes, this stuff does work, but why is it? What's going on with Big Pharma? And why do they want to suppress this stuff and give you and the general public as a whole the message that these things, they don't work? Big Pharma, clearly it is big business. And yes, there's a whole bunch of things going on. Yes, they're going to have extensive costs that go along with like product research, product R&D, actually manufacturing these products. When you dive into it in a bigger way, you're like, there's a whole bunch of valid questions that get brought up, and to make you really question, what they say versus what is actually real. But number one, you got to start with the premise. These are big multinational corporations, and like above all else, what's most important? You're making money, and you're making a lot. Let's take this drug Bravecto. It's actually made by Merck. Big multinational company. They're selling this drug all around the world. It's pretty impressive. You're giving your dog one tablet every 3 months. It's going to kill fleas. It's going to virtually eliminate most ticks. I mean, holy moly. It's like the holy grail, right? What could go wrong? Killing most fleas, killing ticks for 12 weeks with one pill. It required a bunch of years of testing. I'm not sure how much safety testing was done. It's beside the point. But it required an extensive financial investment to do the research, to do the trials, to employ these hundreds, if not thousands of people that are working on this same drug. There could have been maybe 1,000 other different suggestions or formulations, and this is the one that turned out. Okay, it's expensive. But because you patent it, you get control over that drug. No one else can make it. And guess what? You maximize profits for your company, for your shareholders. Nettle, on the other hand, is a green plant that grows parts around the world, actually. It also is great for you as a tea. This little plant with its stinging leaves, it offers some great medicinal qualities for our dogs and cats. Been shown to be really beneficial for allergies, for instance. Really, really like it. But it's natural. It can't be patented. So some big drug company can't come along and say, no, I found it. I just found this little patch of nettle because it grows all around the world. You have to take my nettle capsules and that's going to stop your dog from itching. That doesn't work that way. You can't patent it. Yeah, maybe we should dismiss it. So what are these companies going to do? They're going to downplay its effectiveness. They're going to question its safety. Is nettle really safe? It actually is very safe, but maybe not. That's not what the big pharma company would say. There was a very interesting article published by Medicine Sans Frontiers, and they specifically looked into big pharma, questioning many of the big pharma claims that are especially valid today, and especially in relation to natural remedies. Essentially, what these guys were saying isn't necessarily so. And honestly, these are things I heard while running a veterinary practice. I mean, we would have visit by the veterinary drug reps of whomever it would be, right? Maybe it's Merck, maybe it's Bayer, whomever. And they would talk about their specific drug, they would talk about their specific antibiotic, and they would say why. You know, they've done all the studies, they've done all this research, they've done the safety testing. Like, we can say that this drug is effective, it's safe for this dog, for this cat. Don't recommend that. Like, okay. And, you know, at times they seem compelling, they're great salespeople. You're almost inclined to believe them. It's maybe not so. So one of the claims from Big Pharma is that the cost to develop a new drug is somewhere exceeding $2 to $3 billion. I mean, that is so much money. Yet in many, many cases, when you actually delve into this and actually get the specifics on the numbers, like for instance, what did it cost to develop drug X? In many cases, it's somewhere as low as $100 to $200 million. Nope, still a lot of money, no question. In many cases, that 2 to 3 billion, it's wildly exaggerated. They're exaggerating the cost of R&D, what they say it costs to create that drug, to justify these really high drug prices. I mean, because ultimately, it's important to them as a company to be really profitable so they can give their shareholders great returns, be it in the form of dividends or their stock price going up. The high drug prices, they're helping pay for mergers, acquisitions, their extensive marketing campaigns. Here's another big kicker. Much of the research that is paying for or funding new drugs, it actually comes from you. It comes from your government. I mean, much of this was happening at universities, public institutions. So it starts out there where the public is essentially paid for a whole bunch of that research. The drug companies get involved, they make X big donation, they get the drug, they get the patent, they get to make all the bucks. So really, you're almost paying twice for that drug. So number one, you're paying through your taxes to help that public institution do the research, figure out what drug may be beneficial, i.e. what type of new anti-inflammatory or what type of new drug might be beneficial for cancer. Then secondarily, you're going to pay again when you actually go use or buy that drug at a pharmacy. You're paying with high drug prices. Another big myth is that Big Pharma, they're the hub of innovation. The reality, 2/3 of the drugs hitting the market, they're no better than what we already have. Like, what? Like, how can that be? It's that when you think about it from their business point of view, if there is a drug, I say this drug works really well against yeast, it's already working, just do a minor modification, spend a whole bunch of money on marketing and maybe label design, and sell it again. Slightly tweaked, just slightly different enough. So many of these so-called innovations, they're just me too drugs, just slight tweaks. So in many, many cases, Big Pharma, they're just actually putting more energy into creating these slight variations of current existing drugs than they are focused on developing these new breakthrough drugs. And then there's patents. Big Pharma has become really creative at extending their patents. So patents meaning the drug, it has a certain time span where only you as the pharmaceutical company can sell that drug. They can't create a knockoff. Here's a drug by Boehringer, Meloxicam, one of the first sort of newer generation NSAIDs used in practice. Yeah, worked pretty well. Patented drug, pretty darn expensive. And they have a period of time where only they could sell that drug, and eventually, other companies come along. Here's the actual drug Meloxicam in a generic version, a lot less expensive. But the drug companies, if they could, they want to keep that patent. So in many cases, they can just do a mild tweak. Let's just add one little ingredient and claim that maybe it makes it a little bit better absorbed. Maybe slightly decreases the chance of side effects. And they can apply it. Let's extend this patent for another 7 years. Hooray. So then what they're able to do, if that happens, they can just artificially control the drug prices for a much longer period of time. Wow, we just doubled the length of our patent. And these big companies, are they good world citizens? Well, if you look at what they do in some of these low and middle income countries, take India for instance, they are not very nice. Let's say there's a company in India and they've made something similar to Meloxicam, Meloxicam, that works as a really effective anti-inflammatory, but is much more affordable. These companies, I mean, they're going to do whatever they can to block that company selling this inexpensive, affordable drug. We don't care if it's going to potentially help hundreds and hundreds of thousands of dogs and cats. Too bad. No, you can't sell it. If you're going to get the drug, you need to get our super expensive Western created drug or else. I mean, literally, you could be helping thousands, if not millions of people. But these big companies are going in and no, saying, you can't do that. If you're going to buy a drug that's going to treat X, Y, Z, it's got to be ours because we've got the patent. So while Big Pharma, they're dismissing natural remedies and they're defending their inflated prices, there are big reasons why their drugs cost so much. Don't forget the power of natural remedies. Looking for an alternative for flea control that doesn't involve Bravecto, a drug with potentially a whole host of big serious side effects? Think about brewer's yeast. An alternative to the NSAIDs like Metacam? Look no further than your kitchen cabinet. Look at turmeric. If you've got a dog with serious allergies, you're like, oh, there's going to be something better than this prednisone. Yeah. Think about using Nettle. Or you're getting tired of putting your dog or your cat on an antibiotic for repeated UTIs? You should really be thinking about this, honey. So as you can see, Big Pharma, they have a lot of reasons to dismiss natural remedies. But fortunately, you as a concerned, involved pet parent, you get to choose. So the next time you're faced with a choice, do you use this so-called proven pharmaceutical drug, this antibiotic for the infection? Or use this inexpensive home remedy? Guess what? Just remember the system, it's stacked against this. It's stacked against the alternatives. And as you can see, what Big Pharma says and what is actually the truth is often vastly different. So many of these natural remedies, they are proven safe. They are proven even to be effective. And they've been used for hundreds, in some cases, thousands of years. So they really deserve to be a key part of our pet's healthcare. And in spite of what the big corps say, ultimately it's your choice, your pet, you get to choose. Thanks so much for watching this edition of Veterinary Secrets of how Big Pharma gets away with dismissing natural remedies. Click up there to subscribe, hit the bell to sign up for notifications. Then when you click that link directly in the box below, I can send you a copy of my free book.